followed. Again, even the Center for Plant Medicine and the FDA are also working with traditional and indigenous Ghanaian medication, and as and when work is complete on those ones as well, information will be made available. Schools are not starting soon. Of course, consultations around those have resumed, but it is maybe a question of misrepresentation that schools are starting soon, and one wonders what the definition of soon is. So we are grateful to the Honorable Minister. On Tuesday, May 16, 2020, His Excellency the President launched the Coronavirus Alleviation Program Business Support Scheme. The President earlier in his fifth address announced, and I quote, "Government in collaboration with the National Board for Small-Scale Industries, NBSSI, business and trade associations, and selected commercial and rural banks will roll out a soft loan scheme of up to about 600 million Ghana cedis, which will have a 1-year moratorium and 2-year repayment period for micro, small, and medium-scale businesses," end of quote. Madam Kozi Yankee Aye is the Executive Director of the NBSSI, and I shall invite her to give the people of Ghana an update on the Corona Alleviation Program Business Support Scheme that has just been launched by His Excellency the President. Madam Edie.
Good morning, and thanks for having me, Deputy Honorable Minister. Good morning to our media as well. On Tuesday, 19th of May, the President launched the CAP-BUS, Coronavirus Alleviation Program Business Support Scheme. It was a very eventful and a joyful moment for all of us. And the two products that were part of the scheme were the Adom loans and the Nidasoɔ loans. These two products were designed, as we had mentioned earlier, one, to bring hope to the micro, small, and medium enterprises that had been negatively impacted by the coronavirus that is ravaging throughout the country and the rest of the world. So we believe that these two products would bring hope in Nidasoɔ to the good people of Ghana. Currently, and as the President, His Excellency Nana Addo Dankwa Akufo-Addo had mentioned, 600 million was what he had initially committed towards MSMEs as support for them to grow their businesses and sustain their business at a time when there was so much happening around them. But thankfully, through stakeholder engagements and support from the participating financial institutions, the commitments had increased to 1 billion Ghana cedis. 400 million cedis was added on by participating financial institutions as commitment to support the fight and to strengthen the micro, small, and medium enterprises of this nation. After the launch on Wednesday yesterday, the application portals and the application process was opened. The last time I was here, I mentioned to you that we were testing it to ensure that it was efficient and that we would be able to accommodate as many people and to provide accessibility to the people of Ghana, mostly the micro, small, and medium enterprises. And I'm happy to say that we were able to launch the technology to allow for the micro, small, and medium enterprises to apply. The target beneficiaries continue to be the micro, small, and medium enterprises who have been negatively impacted by the COVID-19 pandemic. Also, those who are making goods and services that will support the fight against the COVID-19. When people think of micro, small, and medium enterprises, the definition, as defined by the Ministry of Trade and Industry, is micro is 1 to 5 employees, small is 6 to 29 employees, the medium is 30 to 99 employees. Any enterprise or business that falls outside the range of 99 employees is not qualified to apply for this intervention. The interest rate, after deliberations with the President and the Ministry of Finance and Ministry of Trade and Industry, after conducting a survey with about 1,700 MSMEs in Ghana, initially we had suggested 5%, but the President, in consultation with the team, decided to review that interest rate due to the plight of the Ghanaian MSMEs at a time such as this to 3%. The moratorium still remains up to 1 year, and during the application process, MSMEs have the option of ensuring that they select a moratorium that would work best for them at a time like this. The term of the loan remains between the range of 2 to 3 years. This was taken into consideration based on the information that we have received even from the Ministry of Information, which states that at this moment, COVID-19, we are all not sure when it would go away. But we are also given the option for MSMEs to be able to hold their businesses and support their employees at a time such as this. Currently, we have received some calls about the technology that we have launched, and I think it's important to share this on a podium such as this. Some of the challenges that have come up are that the USSD code times out at some point. It is important to note that the USSD is a short process, and so we have to be efficient in inputting data onto that. And also there were some technology or network challenges, and so we've worked to ensure that we have an efficient delivery of the USSD going forward. We also have set up a grievance center to ensure that all the complaints that we have would come to that portal to assist us answer the challenges that Ghanaians face. We have received some calls that the code hangs at some point and they are not able to finalize it. This is about 1% of the calls that we have received. And we want to assure Ghanaians and MSMEs, the micro, small, and medium enterprises, that we are working on this day and night to ensure that we give nothing but the best. We are happy to say that we received over 1,000 calls as of yesterday, people asking how they can access the platform and how best they can be supported, and to address some challenges that they might receive. The good news is that to date, we have about 5,000 plus applicants on the platform who have registered and are waiting to go on to the next stage. We are happy to say that we are started and ready. We have provided accessibility. The technology is working. We are working on any challenge that might come up. And if Ghanaians or micro, small, or medium enterprises have any challenges, they should not hesitate to reach out to us so that we can both work this out and ensure that we provide nothing but the best, an efficient system. And they support us to build an efficient system that will withstand the test of time, that can also be used in the future when anything else comes up. So I want to thank you all for your time and your commitment and your patience in working with us to ensure that we deliver nothing but the best to you. And we hope that you continue to reach out to us and you would apply and we'll be able to support you and your businesses grow. For this is a great time to be an MSME. And so we appreciate your support. Thank you very much.
Thank you very much, Executive Director at the NBSSI. Enterprises that have between 1 and 5 employees are defined as micro enterprises. Between 6 and 29 are small enterprises. And between 30 to 99 are medium-scale enterprises. We are told that the initial suggestion was for an interest rate of 5%, but His Excellency the President, upon consultation and in his wisdom, has reviewed that interest rate down. It is 3% now. The moratorium remains 1 year. The term of the loan ranges from 2 to 3 years. And we have been told that interest is very high, evidenced by the over 1,000 calls that they have received so far, and over 5,000 applications that have also been received. You recall that application opened on Wednesday, May 20, and will end on Saturday, June 20, 2020. And so the number of calls and the number of applications happened just over 1 day, and that's some very, very high interest. For those of us who are interested to apply, you can visit the following website: nbssi.gov.gh/CAP support, nbssi.gov.gh/CAP support. If you are interested to use the USSD, please dial *718*555# or call the helpline 0302 747777. You can also email the NBSSI at capsupport@nbssi.gov.gh. We thank you very much, Executive Director Kozi Yankee Aye, for that update. Distinguished ladies and gentlemen, we shall now take our regular update on case count and case management, and the update shall be given by Dr. Patrick Kuma Abuaji, the Director General of the Ghana Health Service. Dr. Abuaji.
Thank you very much, Honorable Deputy Minister. Distinguished colleagues, the media, I'm going to give you a brief update of where we are, as we usually do. I will start by reminding all of us that our strategy remains the same, of containment and control of the virus through contact tracing, isolation, and effective management of all cases, both in isolation centers and our treatment centers. As at the last time we presented here, between the 18th and 19th of May, a total of 173 new cases has been recorded in Ghana. 46 of these cases have come from Greater Accra, 6 from Eastern Region. Central has recorded 27 new cases. Western Region also increased by 59 cases, and followed by Ashanti with 35 new cases. At the same period, we have also recorded an additional 144 recoveries since the last update. And so the total count for recoveries now stands at 1,898, bringing our recovery rate to about 30.2%. But I must let you know that we have a large pool of people waiting for their second test, and I believe that in the next few days, the new numbers will be added. This has come out of, let me get back. So our total cumulative count of cases from the first to the last now is 6,269 cases with 31 deaths. In the same period, up to now, we've done about 187,929 tests, 49,661 coming from the routine surveillance, and another 138,000 plus coming from the enhanced contact tracing. We have so far recorded 31 deaths, as you have seen on the website. Of this number, 8 of them are over 65 years and more. We have 3 who are under 20, mainly 9, 6, among other things. Greater Accra obviously accounts for the larger number of deaths, accounting for about 20 out of the 31 deaths have come from Greater Accra, especially when you look at the fact that about 80, close to 90% of our cases are in Greater Accra. 17 of them are males and the rest are females. And of the 31, 28 have some comorbidity, that is, they have some other illness that also contributed to the outcomes that we got. Further update on our case management. All our 16 regions have so far identified and set up at least one center at the regional level and about 2 outside the region. Treatment centers and isolation centers. You know, we have a total of 71 treatment and isolation centers across the country. This is just to buttress the readiness the system has prepared. Currently, 50 are being functional. Some are not functional because there are regions who have so far not recorded a case, but they are ready with centers for treatment should the need arise, and isolation. This is beside the quarantine centers that we find periodically when there's a need to quarantine people. On our critical cases, so far, we have managed about 31 cases in the ICUs as we speak since the beginning of the pandemic. We've had 6 deaths of people who have been sent to ICU, which means that the rest recovered. 16 have been discharged, and currently there are 8 of them in our ICUs. 4 in the University of Ghana Medical Center, 2 at Ghana East, and 2 at Kolebu Teaching Hospital. None of them is on ventilator as we speak now. Our largest isolation center, that is the Pentecost Convention Center, has a total number of 251 there now. This has been a massive reduction from the 450 or so that we've been recording over the last, since we started setting up the place. That's when it peaked at that level. Okay. Now let me give you a short breakdown of the new 73 cases and where they've come from, so I'll give you some further updates on that. Next slide. Yes. Of the 173, as I said earlier, 46 came from Greater Accra, Ashanti 35, Central 27, Western 59, Eastern is 6, and that is all. But if you look further, you can see that at the regional level, the cumulative total for the regions remain 21 for Upper West, 20 in Upper East, Northern region has 31, and the rest, as you can see, up there with Greater Accra having the lead with about 4,582 cases across the country. The next slide will show you where the districts are scattered. All the districts. This is very similar to what we have. We are seeing that a place like Wesimintim that used to Takoradi Metro, second Takoradi Metro, we used to report relatively low figures, have a surge with recording about 54 cases alone in Central. So you see that place, the color code will change. Zooming back in Greater Accra, the places where you have white also show that they have recorded less than 50 cases, and most of them are quite a few. And the deeper red are where we are having the more significant number of cases in Greater Accra. If you can show the next slide. Yeah, so you can see Ablekuma Central, Accra Metro, among others, showing deep red, part of Tema East showing very huge colors. So these are where we have surges coming from. We have a similar figure for Ashanti region, where we have Kumasi Metro, Boase, Oforikrom, among others, showing the increased number of cases. But like I said, these are the cumulative number of cases. They may have recorded high numbers at that time, but currently, as you saw in the breakdown, in the last 1 week, these places are recording relatively fewer or virtually no cases since we started. So, ladies and gentlemen, I will conclude by saying that we are seeing the new positives slowly declining that are recorded daily. We've seen a gradual decline. But also the number of cases on admission continues to come down significantly in our hospitals. The cases in our isolation centers are also slightly reducing, but we are seeing, and I believe that's going to be the nature of the situation we are in, occasional flare-ups in strategic areas, as we saw in BBNE, Tema, or Boase. But we have strengthened our system to be able to respond appropriately by massing our forces, as we've done in Tema and Obuasi and BBNE, to be able to contain these outbreaks. And I think, like I said, that's going to be the next stage that we are going to look at in terms of identifying hotspots and quickly responding to contain them. We can see there's some containment in BBNE that flared up about 3-4 weeks ago. Tema is under control, and so is Obuasi. Thank you very much.
Thank you very much, Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaji, for that update. Ladies and gentlemen, the update indicates that about 11 regions out of the 16 from the last update up until now have not had any new reported cases. About 11. And so only Greater Accra, the Eastern region, Central, Western, and Ashanti regions have recorded new cases. That has moved Ghana's total number of reported cases marginally upwards by 173 new cases, putting our total case count today at 6,269. We have also seen from the last update up until now 144 new recoveries. And recall once again, ladies and gentlemen, that Ghana's protocol is 2 straight negative results to be declared fully recovered. We are aware that there are several persons in different cohorts who have already undergone their first test, and they are waiting for their confirmatory second test. Inshallah, they again shall test negative, and I'm sure that the numbers of recoveries will go up. That has moved Ghana's recovery numbers to 1,898, over 30% recovery rate that we have today. Let's also take note that we have been told that we have identified, the Ghana Health Service has identified 71 treatment and isolation centers, 50 of which are functional, because there are some regions that do not have cases that require the use of treatment and isolation centers. Whilst we say this, it is important that we continue to pay attention to the preventive etiquettes. The way to get more and more regions to not report new cases is to continue to observe the preventive etiquettes of social distancing. If you do not need to come out, you don't have to. If you have to come out, you should endeavor to respect the etiquette of social distancing, washing your hand under running water with soap. You have to wear your mask. It's important that you wear your mask, because when I wear my mask, I protect. When you wear your mask, you also protect. And the Minister of Information a few moments ago invited us to begin a conversation about living with the virus, the new normal. We don't have a vaccine yet. We do not have a cure. We cannot remain in our rooms and in our houses forever. We have to come out at a point, and we have to lead normal lives, as normal as possible. We have to get back and live with the virus, which means that we have to continue on the trajectory of no new cases. And I think that the people of Ghana who are paying heed to all the instructions and directions that are being given, which is leading to these scenarios that we are seeing of fewer and fewer regions reporting new cases. I think that people of Ghana must be commended. It takes an effort. Let's apply ourselves. Let's continue to do what we are doing, and especially as we are heading towards a gradual easing of the restrictions and then an introduction into the new normal. I think that it's important that we continue to observe the preventive etiquette. So we thank the Director General of the Ghana Health Service and his able staff who continue to sacrifice for Mother Ghana. We also are grateful to our frontline health professionals, doctors, nurses, community health nurses, all those who are involved in Ghana's fight against COVID-19. The country owes you a debt of gratitude. Ladies and gentlemen, one issue of concern to government is stigmatization. And today, we are joined by Dr. Gillian Bugi, a senior medical officer at the Bolgatanga Regional Hospital, Newborn Care Unit. That's a unit. So she's a pediatric resident. Doctor has a story to share, and it's important that we pay attention. Doctor, let me not preempt you. Please join us. Introduce yourself. Speak to us about what you do at the Bolgatanga Hospital. How did you get infected? Because she got infected. And then share your treatment and recovery experience with us, because you have been treated and you have recovered. And tell us if you have suffered any stigmatization since your recovery, And what would your message to Ghanaians be on the importance of observing the preventive etiquettes? Dr. Gillian Bugi, please join me on stage.
Good morning once again. My name is Gillian Bugi. I'm a senior medical officer at the Bolgatanga Regional Hospital. Before I left for my residency program in pediatrics, I was the head of the neonatal intensive care unit. What we basically do at the newborn care unit is to help babies who are born and unable to breathe within the first minute of life, or babies who have breathing difficulties. We also do take care of pre-maturity, that's preterm babies, babies that are born less than the 37 completed weeks. We do take care of babies that have sepsis or infections, and then babies with congenital abnormalities. So I got in contact with the by then suspected case of COVID-19 on the 29th of March 2020. And on the 31st of March, I started showing signs and symptoms. I woke up on the 31st of March with severe bodily pains, fever, chills, and as the days went by, my symptoms increased with dry cough, headaches, and on the 3rd, the sample of the suspected patient's results came, and she had tested positive for COVID. So on the 5th of April, all persons who got in contact with the patient, samples were taken. And on the 6th, I realized I was unable to smell anything. I also had diarrhea. And on the 10th, I had difficulty in breathing as I started to desaturate with sore throat and unable to swallow. At this point, I started to write down messages in my diary to my family, taking pictures of my condition and making videos as well, because I thought one way or the other, I had the virus. All this while, I was taking azithromycin, I was taking vitamin C at home. I practiced steam inhalation, lots of fluid intake. I took a lot of warm tea, and above all, I tried to pray. But our results comes in on the 10th, and my results was negative for COVID-19. But then, because of the fact that I was desaturating and I had difficulty swallowing, a decision was taken that I'm moved to the regional hospital, the female ward, and there I was admitted, and then on arrival, my saturation or my oxygen levels was between 75 to 85% room air. So immediately, oxygen was put on me, and then IV medications started. Even though my test results were negative, came in negative, I had all the signs of the COVID. So a decision, however, again was taken to retake my sample again. And then arrangements was also being made to airlift me to Kolebu for further management and in case of possible intubation. On the 11th, I was airlifted to Kolebu Teaching Hospital Medical ICU. Lots of laboratory investigations were carried out, and oxygen still continued at the ICU. IV fluids were set up on me, and also I was put on a cardiac monitor. After 5 days, my results for COVID comes in, and I test positive for COVID-19. When I was told the results, all what I could ask was if they could immediately take the sample of my sister, because she was with me all this while, even though we were observing social distancing at home. I still asked that they take her sample, and it was immediately done, and her sample comes out 4 days' time. She tested negative for COVID. I spent about 8 days in the medical ICU, and then when I was off oxygen, I was moved to fevers unit, where I spent 12 days together with the other patients who were also at the fevers unit. I had lots of psychological support from experts, senior colleagues, families, and mothers I had come into contact with as patients, both at the maternity ward and the newborn care unit. This played a vital role in my recovery. I was finally discharged on the 2nd of May, 2020. Back home, I was received by my sister and husband, and they have been very supportive. have not yet experienced any form of stigmatization because I have mostly been indoors since I was discharged and have not yet returned to work. The COVID-19 disease is certainly scary, but despite the constant reporting on the total number of cases and climbing the toll, the reality is that most thank them for their work, and let's share positive messages on social media. I will urge the general public to stop the stigmatization of persons who have suffered or who are suffering from COVID-19, for history will judge us by the way we treat them. It is important to practice social distancing, yes, but not social isolation. We must remember that it is the virus, not people with COVID-19 or affected by COVID, is the enemy. Let's not let stigma divide us and then turn us against one another. Let me use this platform to thank our Assistant General Secretary, Dr. Titus Bayo, who contributed immensely in getting me to the Kolebu Teaching Hospital. I will conclude by saying, let's all stay safe, let's stop the stigmatization, and remember to practice social distancing and not social isolation. Thank you.
Thank you very much, Dr. Gillian Boogie. Social distancing and not social isolation. I think that that's food for thought, and we must recognize that, like has been said, the virus does not discriminate. The virus can be, if you may, democratic. Dr. Gillian used to provide care. She also received care. Anybody can get infected. We hope and pray against it. We work against it by observing the preventive etiquettes. But anybody who is infected, like we have been told, the person is not the enemy, it is the virus that is the enemy. And so we should continue to show love and care to even our compatriots who have tested positive. And we must be encouraged by the good news that the vast majority of Ghanaians who have been infected by the virus are doing well. They are recovering, like Dr. Gillian. We expect that very soon Doctor will go back to Bolga to resume her work at the newborn care unit as a pediatric resident at the hospital. So there is no need to maybe even ask about street proof of doctor's recovery. The fact that she was here and shared the stories with us is proof enough that she indeed has recovered. So we are grateful to you, Doctor. You are a true heroine of the struggle. Your country recognizes you, and we shall continue to pray for the speedy recovery of all of our compatriots. Our thoughts and minds are also with the families of our 31 compatriots who unfortunately have succumbed. But let us also use the opportunity to clarify that the way we capture our data, whether you die with COVID-19 or you die of COVID-19, the data captures you. And that's why we keep hearing of comorbidities, people with other underlying health conditions. And so, strictly speaking, if we may even want to further interrogate that data and break it down to people who died with COVID-19 or people who died of COVID-19, the persons who died of COVID-19 are even lower. But we have captured all of those in the 31. I say this to encourage all of us that there is no reason at all, there's no basis for anyone to want to look down on anybody who has ever tested positive for COVID-19. We can come back to normal on our own immune system with the help of the medical practitioners. And so please, let's continue to show compassion love and care to our fellow Ghanaians who, and even non-Ghanaians who may have tested positive for COVID-19. Thank you very much, distinguished ladies and gentlemen. May I now open the floor for questions? If there are any questions, please, let's step forward and let's do this quickly so that our busy health professionals can get back to the business of caring for the sick, contact tracing, testing, and so on and so forth. And let us please also observe the social distance. We can take it two at a time. Your name and your quick question.
Okay, my name is Bridget Ayakomate, Metro TV. For the NBSSI, did you say companies with above 99 employees are not qualified for the loan or below? I need that clarification. And do you have any special attention for businesses owned by PWDs? And what are the sanctions for defaulters?
My name is Sarah Parker, representing Media General. I have just two questions.
If you may, so we can, AD, companies with employee staff of beyond 99, are you saying that they are not qualified? Number two, do we have any special arrangements for persons with disabilities? And are there any sanctions for people who would default on the loans? Yes, sir. Next question.
So my first question also goes to her. I want to find out which category does the schools fall under, the private schools? Because yesterday it was still hammered by the Deputy Education Minister that they qualify to apply for this stimulus package, and they are asking for preferential treatment. We want to find out, do they fall under any of these categories so that we don't come back and hear issues like them being discriminated against. Let's know the category they fall under, who qualifies and who doesn't qualify. And secondly, to the Ghana Health Service, we know there is a committee that approves publicity on COVID-19 safety protocols. The EC has come out with 6 safety protocols ahead of the voter registration exercise. Is the committee aware? Has it approved those protocols? Thank you.
You want to share those protocols with us?
Yes, they talked about having 1 gap meters between people who line up, having hand washing bowls around, sanitizers will be distributed to people who would go through the process and leave. No face mask, no coming to the registration center. So basically, those are the things they are looking at going through.
Thank you.
My name is Joseph Akabila. I work with Joy News. My first question, health experts have made a point that if we have a lot of infections, our health system may be overwhelmed. The Director General made reference to the fact that there are some sort of centers across all 16 regions. I want to find out in specific terms, what is our capacity in terms of our ability to have people in various centers and provide treatment for them across the country?
You mean numbers?
Numbers, the total capacity that we can hold.
Bed numbers.
Yes. And the other
This allows for transparency, allows them to see who they are lending to, because the banks own the lending process, will be able to monitor. And if you default, it's a credit, it's a risk. And so they would ensure that the next time if you need challenges or you have problems, you are not recommended. So all of that are some of the sanctions. The other sanction is that next time when there's an intervention, we will not pay close attention to you. But it's also important to note that in everything you do, you need to look at the risk and how to mitigate the risk. So what we have done with this program, besides the financial support, we have technical assistance and support. The technical assistance and support will ensure that we are monitoring and following up. We're giving you training to also turn around your business if there's a challenge. For those, especially in the micro sector, who do not have very good bookkeeping skills or systems, we look to digitize and support them with it. Because the world has changed. A lot of things we will do going forward would be based on digitization due to the challenges that the COVID-19 pandemic brought. So it has also brought some good and changes to the sector for the micro, small, and medium enterprises. You asked about the private education. Yes, as I mentioned, education, private schools can access these loans if they fall within the targets that we have set. So they are eligible. Now, you mentioned if they do not fall and if they feel discriminated against. It is accessible to everybody. It is not to discriminate against an individual or to discriminate against a sector. So if you feel the need, if you think you need the funds and the support, go ahead and apply, and we'll allow the system to work to ensure that you get what you need. Thank you very much.
Thank you very much. And it's also important to note that at the launch of the support scheme, His Excellency the President directed that the highest levels of transparency and openness be observed during the entire process. And so we look forward to that. And it is in the spirit of transparency that the Executive Director is even here on the podium to walk us through who qualifies. Ladies and gentlemen, you know that because of social distancing, some of our colleagues are watching from home and the various offices and are asking questions through our WhatsApp platform. I shall invite Mr. Kweku Obing Eje to give us questions from the platform. Kweku.
Thank you very much, Honorable Deputy Minister. So just a follow-up question to the bit on the NBSSI. Are there other factors for determining who qualifies to apply for the stimulus package? Is the number of employees the only criterion? What about turnover, for instance? Because it's possible to have a company with over 100 employees that generate a turnover that's lower than a company with, let's say, 25 employees. So that's a question to the NBSSI boss.
So before the NBSSI boss